69 seconds. That's how long it took for Conor McGregor's UFC comeback to end Saturday night at UFC 329, and how long it took for his right knee to give out doing something a professional fighter does 1,000 times in camp, throwing a kick. Dana White says it's a torn ACL. I've spent 28 years with my hands on knees just like his, and I don't think that's the whole story. I'm Dr. Robert Moss, a physical therapist and board-certified clinical specialist. I have not examined Conor McGregor's knee, and nobody outside the UFC medical staff knows exactly what's torn in there yet. But the mechanism of this injury, what his knee actually did in that split second, tells us a lot more than a headline does. Let's break it down. McGregor came out throwing a flying kick in the opening seconds against Max Holloway. He landed awkwardly on that right leg, and you can see the knee buckle on impact. He tried to keep fighting, threw a couple more strikes, but referee Mike Beltran stopped the bout at 109 of round 1. Holloway was actually the one telling the ref to stop it. TKO due to injury. McGregor's first fight back in over 4 years lasted a little over a minute. Dana White came out after the fight and said the promotion is assuming it's a torn ACL, an injury that typically sidelines a fighter 6 to 12 months. Some outlets are reporting a different read. A possible meniscal tear, maybe on top of an old issue, which would actually be a shorter recovery. Nobody has an MRI result to point to yet, so instead of guessing at the label, let's look at what his knee actually did. Most non-contact ACL tears happen on a simple plant and cut. The foot is fixed, the body rotates, the knee buckles inward. That's a clean single structure injury. What I saw here is different. McGregor lands off balance, off a jumping kick with his legs somewhat extended and his body weight coming through the knee that's absorbing rotational force and a side-to-side load at the same time. That combination of valgus force, knee collapsing inward, plus rotation or a varus force with the knee buckling outward is exactly the mechanism that damages more than just the ACL. It's the same pattern we see in what orthopedic surgeons call the terrible triad. ACL plus the MCL on the inside of the knee, or the posterior lateral corner structures on the outside, the ligaments and tendons that keep the knee from rotating and gaping open. 3 things stand out to me watching this back. 1, the knee visibly buckles at the moment of landing. That's more consistent with the ligament giving way under combined load than a simple twist. 2, he could not continue at all, not even to stall. That level of instability usually means the knee doesn't have a functioning secondary stabilizer left, which points to more than one structure being compromised. 3, the mechanism itself, a jump kick, landing with the leg loaded in a rotation position, is a classic setup for a multi-ligament injury, not an isolated one. I want to be very clear. I have not examined him, there's no MRI, and I could be wrong. But if I saw this mechanism walk into my clinic, I would be testing his MCL and his posterior lateral corner just as carefully as I'd test his ACL. And I would not be surprised if imaging shows more than one structure involved. Let's talk numbers. Because this matters for how people think about just get surgery and you'll be fine. An isolated ACL reconstruction runs 9 to 12 months for a return to competitive sport. In combat sports, tend to sit at the longer end because of how much rotational single leg loading fighting demands. And add the MCL, and research on elite athletes show average return to play closer to 10 months. Add posterior lateral corner or PCL involvement, and that number stretches out to around 15 months on average. A full knee dislocation with multiple ligaments torn, worst case, averages close to 20 months. And the numbers on getting back to your previous level, not just back on the field. More than 3 out of 4 athletes return to some level of sport after a multi-ligament reconstruction, but only about 60% get back to where they were before. Athletes with posterior lateral corner involvement specifically return at a slower rate and slower pace than those with just an ACL and MCL injury. Now, layer in McGregor specifics. He's 37. He already has a documented history of a severe leg fracture from his 2021 fight with Dustin Poirier. Age and prior injury both push recovery timelines towards the longer end of every range I just gave you, not the shorter one. If this is a confirmed ACL alone, I'd expect a realistic 10 to 12 month runway before he's even cleared for full training. If it's ACL plus MCL or posterior lateral corner, we're realistically talking 12 to 18 months before he's fight ready, not just able to jog. Here's what people underestimate. The surgery and the physical healing are actually the more predictable part. The harder part is rebuilding the specific demands fighting places on reconstructed knees. Checking leg kicks on one leg, absorbing a takedown, pivoting off a jab, sprawling under weight. Those all load the knee in rotation, under fatigue, against resistance, exactly the position that caused this injury in the first place. On top of the physical rebuild, there's a psychological piece we see in almost every returning athlete: hesitation. A guarded, protective movement pattern where the body subconsciously avoids fully loading that leg. In a sport where hesitation gets you knocked out, that's not a small problem. And he'll be doing all of this rebuilding at an age where recovery capacity, tissue quality, and reaction time are already working against him on a leg that's now suffered 2 serious injuries in 5 years. I want to be fair here. Plenty of athletes have come back from multi-ligament knee injuries and performed at a high level again. It is absolutely possible. But realistically, for a 37-year-old fighter with a prior major leg injury, looking at 12 plus months of rehab minimum, this may end up being the injury that decides whether he fights again at all, regardless of what he wants. That's not pessimism. That's just what the data on athletes in this exact situation shows us. You don't have to be a UFC fighter for this to matter to you. If you've twisted a knee and it swelled up and buckled or never felt fully stable again, the worst thing you can do is guess. Don't ignore it. Don't mask it with a brace and ibuprofen, and don't just do something, do the right something. Starting with a proper clinical exam of every ligament in the knee, not just the one everyone assumes is torn. That's the whole reason I do this channel. I'm Dr. Robert Moss. Move well, live well. I'll see you in the next one.